Assalamu alaikum wa rahmatullahi wa barakatuh. Nkwaniriza leero ku programu yaffe obulamu nange Mariam. Wano ku Salam TV olutimbe olw'emirembe. Mwebale tulaba mwena abatulabiri eyo ku Go TV ku Star Times. Abali kwa from mobile, abatu streaminga live ku TV, ku YouTube, abatu streaminga ku Facebook. Ne socials zaffe zonna abali ku TikTok, abali ku Instagram. Eri bagiyita batya space. X space yali Twitter bwenna mwebale tugoberera n'abatuwa ebirowoozo okuimprovinga wali na wali. Eno program eriwo okusomesa ku bikwata ku bulamu bwo era tukuleetera topics ez'enjawulo era tukuleetera abasawo ab'enjawulo ate babeera bakugu bakuliiramu ne bakugamba mbu kino ky'olina okukola kino ky'olina okukola okubeera omulamu. Olwaleero tugenda kwogera ku kintu ffenna kye tusinga okwenyumirizaamu akamwa kaffe. Munnaye akamwa kano bwe kabeera nga si kayonjo nnyo oyinza okwesanga nga obulamu tebukweyagala ate omuntu awunya akamwa munnaaye akusemberera bw'ati n'otunuulira eri ne bw'abeera muntu wo waakiri abamu omugambako naye akamwa munnaaye kaba kazibu nnyo tukeeyagaza nnyo abamu ku ffe tugamba it is your favorite body part naye munnaaye bw'otakayonja oluusi oyinza okwesanga nga ebintu tebikugendedde bulungi. Ebiseera ebisinga mumanyi nti okujjanjaba amannyo gaffe oba akamwa kubeera kukuula mannyo naye it is more than that. Olwaleero nkuleetedde omusawo w'amannyo oba dentist oba muwayita abakozi b'amannyo akunnyonnyole olabiridde otya amannyo go okubeera nga malamu ate osobola otya okukuuma amannyo nga togakudde naye n'osigala n'amannyo go ate ng'oli mulamu bulungi. Kababuuzeeko atubulire leero kiki kyatuleetedde. Sibyo tyano Dokita?
Bulungi Madam Miriam.
Tubuulire kiki kyotuleetedde leero obuuzaako leero abakulaba ku Salam TV.
Viewers of Salam TV, mujja kunzikiriza nkozese English
n'Oluganda olutonotono.
I mix up. Mbalamusiza abantu ba Salam TV. Abatulaba ku Salam TV kansuubire nti muli bulungi nga bwe bagambye. Nze omwami David Mugarura, nze ndi musawo w'amannyo oba dentist.
Okay. Webale nnyo musawo David agenda tubulira. Ayinza okukozesaamuko Oluganda olutonotono naye agenda kukozesa Oluzungu okusinga kubanga munnaaye tetwagala ate ayogere ebigambo abyogere bubi mugambe nti omusajja ayogedde bubi olulimi lwaffe naye twagala mutegeere kyayogera. Kati Dokita leero olwaleero tugenda kwogera ku ki naddala ku mannyo?
Nga tetunagenda ku ekyo badde nsaba okweyanziza abantu ba Salam TV for the opportunity given the administration of Salam TV. It is not my first time to be here. This is my second time for the aspect of health. At first I was here for oral health teachings, but today we are here for one issue known as orthodontic treatment. Orthodontic treatment, it's a joint word, but it has two different words. Also, it's a Greek word meaning unlining of Okutereeza. Then dontics, of course, atwatwogera ku mannyo kati ekyo kigambo ekinyonyola okutereeza amannyo.
Orthodontics.
Yeah.
Orthodontics. Oluzungu lwa medical luba luzibuzibu naye tujja kugendera awo. Tubulireyo ku bw'oba oyogera ku orthodontic ng'oggyeko okulaba nti mu kutereeza it is aligning. What is orthodontic? What does it involve? What does orthodontics involve?
Nga bwe nkugambye nti ortho kitegeeza okutereeza ka dentics oba otereeza amannyo. So it really involves the aligning of the teeth arch and the jaw.
Okay.
Kati mweno discussion ndaba nti wetuba tumaze abantu bajja kuba balina okutegeera what is orthodontics, ni yeetaaga orthodontic treatment, at which age someone needs the orthodontic treatment, the limited number of years one has to have that treatment, who needs orthodontic treatment oba ani oyo yeetaaga okutereeza amannyo n'ebirala.
Okay. So what does orthodontic treatment involve?
It involves the unlining of your teeth arch. Yeah.
Okay. How do you do that as doctors? Do you just go and put a line, straight line like this, and you start hammering with a hammer and you put the teeth straight? What does it involve?
Yeah, it has different ways of achieving the treatment. Okay. One, there is this common known braces. braces nkimanyi nti abangi kati bazitegeera bazimanyi. It involves, the braces involves having a line of a wire with the brackets. Brackets we bateeka ku mannyo nga wano n'oteekako akantu wano n'oteekako akalala kati n'oyisamu akuuma ebeera wire. That is one. Another one, there is what we call liners. Liners, it's a plastic, it's made of plastic, okambala kati basooka ne tukupima ne tukakolera. Kati wokambala nga kasobola kukwata amannyo go gonna n'okambala bwoti ne kakwata lino but in a good line. Kati with time it causes the movements of the teeth. Eribadde bweru eridda ku line, eribadde munda eridda ku line, and you achieve a better smile that you wanted and the proper occlusion.
Okay. So those are some of the things you need to do to put your teeth in order. Why do I need to do orthodontic treatment really? Lwaki mba neetaaga okutereeza amannyo? Kubanga amannyo gaakulya. Lwaki mba nina okugatereeza?
Kati gano amannyo nga bw'ogalaba wano bwe gaba tegateredde oyinza kusanga gali bwe gati. Oyinza kusanga gali bwe gati. Oba oyinza kusanga gali bwe gati. Kati bwe gaba tegateredde nga bwe gandibadde, trust me, n'okulyako kujja kuba kuzibu. Okwogerako kujja kuba kuzibu. Appearance yo nga bw'olabika. You may not like the way you
smile. Some people find it hard to smile, by the way, because of their...
Then also your cleaning as you're brushing. If this tooth is inside there, let me use an illustration of my fingernails. This is a tooth, this is a tooth. One is inside. When you are brushing, the brush will pass on top, but the food particles will stick here. So which will be very hard for you. At the end of it all, you develop calicula's, you develop cavities, you develop very many unhygienic characteristics. So it's better when you align your teeth very well in a normal way, in a proper arch. It will be very easy for you to brush. It will be very easy for you to smile in public. It will be very easy for you to have a proper occlusion or proper intact of the upper jaw, the mandibular and the maxilla. They have a proper occlusion, meaning that you have a proper bite. And you have a proper chewing.
Okay. Thank you so much, Doctor. In most cases, we have very many people who have teeth which are not actually in order, especially the adults, and they think it's normal. Or having, like, we have people who have not actually removed their milk teeth, and they think it's normal. What advice would you really give such a person? In case, for example, that person is your friend, how kind can you be to really talk to this person and encourage them to take orthodontic treatment?
Okay. Thank you so much, Madam Mariam. The reason why people get comfortable with their disabilities, most of times it's because of ignorance. They don't know if this thing exists. Some people might think that's how God created me, and I think there's no any service that can be worked against me, rather can be worked on me, and I correct my issue. But that person, I would really encourage him or her to come to visit a dental officer or your dentist, or you can contact me. You come. We do also, because after telling the person the disadvantages that are in having a malalignment, a malalignment, I mean having a disorder of your teeth. If after knowing the problem that is resulting from that, because most people think that teeth are for only eating and they do not cause any harm. Not knowing that when you have improper occlusion, you might have a problem of damaging your gum, developing gingivitis, or wounds.
What is gingivitis?
The wounds on your gingiva.
You have ever explained that, but there is someone on set right now who has never had gingivitis.
Gingivitis, gingiva, it's another word for the gum. Yeah, so when I say gingivitis, it's a disease affecting the gum. Gum developing wound-like. Is
it the one which causes the gum to bleed?
Exactly.
Okay.
When you are flossing, you bleed. When you are
brushing,
you start bleeding. Yeah, that's gingivitis.
Okay. Okay, thank you so much. Balabi baffe abalungi ali ku Salam TV. Munaye leero tugenda kukola akasavu kanyama Luganda n'Oluzungu. Luganda lujja kuba lutonotono. Doctor, tell us the difference between orthodontic treatment and dental treatment.
Okay, thank you so much, Madam Miriam. Orthodontic treatment, basically, it's basically on aligning of the teeth and the jaw. You know, some people, there are different classes of occlusion. One, it's class 1, class 2, and others.
Okay.
So, for example, when I say class 1, there is, we base on this relation of the upper molar and the lower molar. Yeah, however much that is kind of tricky to explain to a person that hasn't studied this, but but that's how things are.
But we even don't know how many teeth we have behind there actually. Because it is even hard actually to know, do I have teeth behind there?
Yes.
You feel it, but you don't know how many there are there.
So there is that correlation of the upper and lower. That is class 1.
Okay.
But when we talk about class 2, you find a person having this protrusion. Some people are like this. Person is closing the teeth, but
the upper jaw is there is this coming out.
Yes, that is class 2. Then you find other people having this protrusion. Rather,
the lower one is the one which is coming.
Yeah, the one coming. So when you do orthodontic treatment, we pull your jaw together to the normal way.
Do you do it physically or it's a gradual process?
It's a gradual process because, of course, when you do it physically, you may tamper your temporomandibular joints.
Because I'm seeing you forcing it to come, like to align, but
when your lowers are the ones protruding, and this one is proclining. Of course, we might deal by extracting some teeth here, then we put the braces, we pull, but it's a gradual process. It takes you like 6-8 months.
Oh, so it is a gradual process which goes on for months to align the whole thing.
Yeah.
Okay. You talked about braces. Do people who have braces eat food?
Yes, they do.
How do they brush? Doesn't food, you know, when normally, for example, you are eating and you don't have braces. For example, I don't have braces. Food gets stuck in my teeth. How does this person survive with braces? And food, and do they eat meat? I'm trying to imagine the life. I've never gotten the courage to ask someone who has braces because it's a bit embarrassing actually to ask. Is it really normal?
Yes, of course. When you introduce something that you've not been having before, there is a change in your life. You get my point?
Yeah.
Since they are there temporarily, you have to bear with them and treat them well so that you attain the service you acquired. One, if you've been used to eating those hard things, you might be advised that regulate, eat things that you know that will not tamper with your treatment. As anyone that is on treatment is advised on how to feed, on how to behave, on how to move, so that you attain the treatment that you acquired.
So there are do's and don'ts for braces.
Yes. After eating, make a thorough cleaning. When you visit your dentist, 1 week after, you have to visit your dentist again. Because when you're brushing, you may not brush well. But when you come and we do scaling and we brush properly with the machines, we ensure that you are clean.
Okay.
Yes.
You have already told us how long the treatment does, and that is around 8 to 6 months.
Depending on the severity of your case. Because some people, you might find someone has a tooth here. Like you have talked about the issue of someone's milk teeth not shedding off.
Okay.
And the person develops the permanent teeth. Most of them always come from this side because here the jam is ready, covered. So the teeth come from here. So
can't you just remove those teeth and then we remain with these permanent ones? For example, if you realize I didn't remove my milk teeth and I have permanent teeth, like I have 2 lines of teeth, okay, overlapping teeth, that's what I can say. Can't you remove these presumed milk teeth and I remain with the permanent ones only?
Exactly, that's what we do, but when you have your milk teeth that grew normal here, and it has failed to shed off, the permanent teeth will come from here. So what we do, we extract the milk teeth and bring the permanent teeth that grew out from the gum on top of the gum. Then we bring it for proper occlusion down. Okay. But of course it takes time. Now that person is different from one that didn't have that kind of a case. Maybe he had a very small malalignment. That person can take like 6 months, but this one may take you like a whole year.
Okay.
Basing on the severity of your case.
Okay. What factors actually lead, or you have mentioned some of them, what factors can someone have to really think that they need orthodontic treatment, extreme ones? Because honestly speaking, we used to think that braces are for luxury. Bagaita malala. We used to think that those pretty girls, those girls who have money are the ones who are actually having braces in their teeth. What factors can lead to someone to have orthodontic treatment?
Okay, one thing that we'd like to drive off our mind, it's not luxurious, but it's a medical treatment.
Okay.
Yeah. One, if you have crooked teeth, like there are very many, they are crowded, two overlapped teeth. Another one, when you have twisted teeth, some teeth are twisted. When we are setting such teeth for dental technologists, you might have your teeth twisted. Let me say.
Now you are removing somebody's tooth.
Just this is an illustration. You find your teeth is like this. It's twisted.
It looks like the vampire one.
Yes.
The pointed one.
It's twisted like this. But normally, there is a major and a distal end of the tooth. And we all know there is a major inclination, the distal inclination, the backward and lingual. So we base on such principles of tooth setting, we put tube braces to bring it to normal. And it goes back to normal? It goes back to normal. Okay. Yeah.
Oh, that's amazing. I thought it was a luxury, actually.
No, it's not a luxury.
At what age can someone get orthodontic treatment? Because I've seen babies, not babies, but from toddlers, like around 10 years, youngsters, teenagers. At what age can someone do orthodontic treatment?
One, we have to ensure that the person no longer has milk teeth. Because you aligning the milk teeth that will shed off, it's equal to zero. It doesn't make sense. So we are sure that someone at 9 years no longer has milk teeth, unless it's an abnormality. 9 to 14 to 15, it's a good age. Because even those people, they are still growing and their bodies are flexible. You cannot compare a jaw of someone with 12 years to someone with 45 years. However much, we do not have a limited time for that. Even at 90, you can correct your arch, but you do not expect to achieve it as early as possible, like one of 14 years.
Oh, yeah. That means age matters? Because when you are still young, they tell us your body is still growing, and at a certain age, there is some stagnation, especially in the bone adjustments. When you tell me about the 90-year-old there, I concur with you. Yeah. So what other factors apart from crooked, you said?
We have talked about the overlapped ones.
Overlapped?
Yes. The overlapped teeth, katugamenti n'erinnya liri waggulu wa lino.
Baziyita angereka.
Gagerese.
Baziyita angereka.
Exactly. That person also need an orthodontic treatment by lining them to the proper arch. Yeah, proper order of the arch.
Okay. Take us through the process of doing orthodontic treatment.
The process of doing orthodontic treatment, one, it's examination. Yeah, as doctors, for us, we believe, because we always face that kind of a challenge. Someone tells you, I want braces. How much? I will not yet examine you.
I just walk into your clinic and say, you want braces. Yes. That's what I was telling you.
Exactly. But when you get a chance and the person comes to the clinic, of course, I put you at a dental seat, I examine you. Then I see what is needed. You find a patient is actually overrating it. It is something simple. Or the patient is underrating it. So when you talk about the process, of course, you have to first clean the person. That's one. After examination, you clean. you identify the case, whether it's class 1, class 2, it's an overjet or a crossbite. After identifying the case, you clean. After cleaning, of course, when you know the case, you know how to treat it. But if I told you if it is like this, I can first extract this so that I pull your lower to that. Because the upper, the maxillas are very hard to deal with. You rather temper with the lowers
than the uppers.
Yes, the lowers can correlate with the uppers, which is difficult. For the up, this is something different.
Yeah. You mean if I was created like that?
No, you can have a solution for that, but when we are tempering with it, we know what goes faster than the other.
Okay.
Then, of course, you as a client, as a patient, when you want braces, you tell me the color you want of the brackets. There's a variety. That's why
I usually see blue, blue and pink.
Black or pink. Yeah.
Oh my God, that is a bit hard. You know, having braces in your mouth, we had very many, as growing up, we used to have very many ideas about braces and very many opinions about braces. What if I have a cavity in my tooth? Do I still get qualified to get braces?
Yeah, of course, as a dentist, when he or she examines you, sees the other cases that you have. Most people come looking for braces, but you find someone needs some replacement, needs what we call cementing. Get it?
I was somewhere over the weekend and a girl was saying, cement wanga with them.
Exactly.
Can me, I used to say they go to the hardware, they buy cement and put in the tooth.
So before I do that, it's alignment. I first see other cases that you deserve to be corrected.
What is cementing in the dentist like vocabulary?
Indeed, it is cementing, but we do not use that cement.
The one of the hardware.
Yes, it is not that cement.
Okay.
It's a dental material, specifically not the hardware cement. Then another thing that people who need the orthodontic treatment, people with diastemas, or is it called people with gaps in the teeth? Mostly.
But people like it.
People like it.
Some of them come to the hospital and they say, njagala akazigo, bakaita akazigo.
Yes. Yes, you can, but it's a disorder according to dentistry.
They mean the normal one is a disorder?
Yes, it's a disorder according to dentistry. Do you know
how women like that, Kathy?
Yes, they like it, and you don't tamper with people's choices, because even there are some clans in Africa who are identified by removing the anteriors. People like our brothers from Kenya, our brothers from... Yes,
and they feel it's normal to remove.
Yes, it's normal for them. They extract it, even if it's not...
It's not
damaged. It's in a normal way. Actually, I think they extract it when their children are young. But in dentistry, really, that is not good.
What are the disadvantages of having gaps in your teeth?
Having gaps in your teeth, one, it will expose your gum to dangers. Maybe you're biting something, it goes straight to the gum. Two, when most of them, they have it in the maxilla. And some of them are genetical. You find like the whole family.
I'm saying.
Yes.
Yeah.
And that is it is caused by having that spongy skin in the middle here. Most of them, some of them are genetical, and you cannot blame someone for that. But other people, like those tribes I've told you about that they extract, it is very dangerous. One, it exposes your gum. Two, when there is a gap here, you'll have a major inclination of the adjacent teeth to cover up the gap. Most of the times when you extract a tooth, you find the gap is decreasing with time.
Okay.
It's decreasing with time, meaning the adjacent teeth are growing towards covering that gap. So when they cover it up, they affect the occlusion. If the gap has been from the upper, and these teeth are trying to cover up the gap, but remember these teeth were occluding with the lower, so meaning the lower will be left behind. At the end of it all, you attain an improper occlusion.
Okay, webalinya doctor naye obuzigo bw'abantu buveeko kubanga babwagala nnyo bwojja bwesonyiwa kubanga abakyala bajja kukyayira bwere bagamba oyo tomuzza omulabi wa salaamu omulungi webale kwekumira ku programu yaffe eno mujja tusonyiwa mukole tukozeseza oluzungu kubanga omusawo lwasobola okuba communicatingira obulungi n'oluganda olutonotono lwe twogedde kangendeko mu bulango bwa bakama bange tova ku Salaamu TV.